A tuberoplasty is the shaving of the greater tuberosity so it no longer causes any impingement in the shoulder. Now, it has nothing to do with repair. In fact, the reason you're doing a tuberoplasty because the rotator cuff cannot be repaired. With a big tear, the tendon is retracted and there's a big gap. So if you look at it in a model, it'd be something like this with a big exposed area. When people try to lift their arm, it pinches the bone and causes the pain. A tuberoplasty would be done. We could do it either arthroscopically or a mini open incision. We shave the tuberosity down, so when you lift the arm up, the tuberosity no longer impinges on the bone on the top called the acromion, and that is what's causing the pain. The procedure is done as an outpatient basis, including anesthesia and waking the patient up. You're looking like an hour procedure. The typical candidate is someone who has a large tear of the rotator cuff that cannot be repaired. Someone who does not have much arthritis in the shoulder joint and has some preservation of muscle function that will allow him to lift the arm if the piece of bone is no longer impinging. Because you're doing a resection, there's not a lot of immobilization, and they could start doing things immediately. We do emphasize the initial portion to work on strengthening the muscles below the shoulder level and not to put the area where the bone was resected at risk. So we ask them to avoid overhead lifting and carrying. The success has been remarkable. No patient this time has had to have a revision procedure to replace the shoulder.